White fungus is playing a major role in India in terms of spreading infection among people, and it's very devastating to see people suffering with so much around what's happening around them. Mainly the white fungus spreads because of the unsanitary use of oxygen cylinders or the overuse of steroids that can actually heighten the risk of contacting the white fungus. Using tap water in the humidified attached to an oxygen cylinder can be a major contributor. It seems that these molds are present in water, and we are liable to catch this infection quite easily. So it's good to make sure that the water we use is completely clean. It's all about sanitization. We need to pay extra attention to our body symptoms, because white fungus indicate the same symptoms as COVID-19. But when some patients were tested for COVID-19, they were tested negative. But when their samples were taken further for investigation, maybe, or even diagnosed through an X-ray or a CT scan or a HRCT, which is high resolution computed tomography scan for chest. When they did this test, they were able to find that there were traces of white fungal infection for these patients. So normally these fungal infections appear on the skin, and they affect the kidney, the brain, the private parts, the mouth, the nails. To catch white fungus, it's the same. People with less immunity, people who have survived COVID-19, diabetes patients, cancer patients, organ donors, organ transplant. You need to build your immunity. So be very careful of what you're taking into your system, be it fruits, vegetables, or any type of food, what you're eating, the water you drink. It's all about sanitization. And the pre-existing medical conditions reveal that the treatment will take at least 4 to 6 weeks, but they cannot promise complete healing. As of now, the disease, the white fungus, is spread mostly in partner. So who is at a risk of getting the white fungal infection? It can be people who are on prolonged use of steroids and people with low immunity. So let us spread this awareness, and particularly there are some group of people who I know who do not watch the television for so many other reasons. So at least if this video is shared to them, they will understand about the infection and the seriousness of this disease. So it's better to stay safe and take necessary precautions. As for COVID-19, the basic things is SMSD. S for sanitize, M for mask up, S for social distance, and D is for do only the essentials. Advise your family and friends not to engage in any activities pertaining to the soil or environment. It's good to keep it clean, but use gloves and use the necessary equipment to get the cleaning done, and keep your place completely germ-free. So these are the only things which the doctors themselves have suggested. Cleanliness, eat healthy, stay indoors. Thank you.